Even after decades of interventions, malaria is still one of the biggest killer diseases on the continent. In 2015 alone, an estimated 429,000 people died of it, according to the World Health Organization, 90% of them here in Africa. Earlier on, CGTN's Ramah Nyang explored the economic damage malaria does to African economies with the CEO of the African Medical and Research Foundation.
Now, if you look at malaria per se, 90+ % of all deaths in malaria are in Africa, globally. So you're looking at, in Africa, losing about maybe 1,000 people per day from malaria, on top of many others who are sick, but they don't die. So there is first the lost economic activity of the people, and because malaria also kills very young, then when you look at now the economic burden to the nation or to the continent in terms of the years they would have lived and contributed to the economy, it is huge, because if they die under 5, you're talking about 59 years lost in life. That's huge. Then there is also the other cost of managing the disease itself. Right now we estimate maybe it takes about $300 million a year to manage case management for malaria, just for people who go to the clinic with fever. And 300 million over a 10-year period, you're talking $3 billion.
That figure could be a lot higher, because health expenditure, at least in Kenya, and it's pretty much the same for a lot of other sub-Saharan African countries, tends to be one of those catastrophic expenditures, things that can actually send households back into poverty.
You see, when we talk about catastrophic health expenditure, it's where somebody has malaria, ends up in ICU, and in ICU, and then they have to sell their cows, their land to pay the ICU bill. You know, and 1 million people in Kenya, maybe 1 to 1.5, going to poverty because of this issue. So that cost is actually much more. This is just what is estimated by WHO. But the costs are much more than that. I mean, health economies may not even account for the bus transport the mother had to take from the village to go to the hospital, and of course the lost wages,
the opportunity costs,
and the opportunity costs and all this. So it's huge. It's unimaginable. Actually, if you're just now to look at what gains you can get by introducing something that reduces the death rate by 10%, 20%. So far, if you look at the work done on malaria, we focus a lot on mosquito nets, long-lasting insecticide-treated mosquito nets. And that has contributed to maybe 60, 70% of all the reduction in malaria. Now, when you look at that 60% reduction in 15 years of the Millennium Development Goals, and then you say multiply that by 300 million or more per year on case management, and then multiply that by the saved lives, which are more than close to 600 million lives saved in 10 years from just these interventions alone, the economic gain to Africa is